Hello again, YouTube. Here I am to discuss day 2 after surgery. Would have put all that in one video, but 7-8 minutes at a time was definitely enough for me to talk. Neck is still pretty sore, throat's really sore, so I had to take a break a little bit and get a little something cold on my throat. Starting out this morning, they came in and got me up at about 6 o'clock. As of right now, I'm 34 hours post-op, so doing pretty good, I guess. But 6 o'clock, they came in and got me up, moved me into a chair, out of the bed, got me moved into a chair. The nurse said that the PA from the doctor's office would be in shortly. He's going to have a discussion with me, and I would see physical therapy, and I believe that was the only two that was coming in. So got my chair, sat there for a little bit. I actually got up with the nurse, and she walked me around the hospital for probably about 5 minutes, just kind of get moving. Came back, sat down in my chair. Pain was pretty intense to start out with this morning. Moved me from the morphine to the Norcos. Started taking 2 7.5 milligram Norcos, which didn't completely knock the pain out, but it made me comfortable. So what more could you ask for following neck surgery? Swallowing's getting a little difficult right now, but anywho's, sit there, waited on the PA. He came by and talked to me, kind of just discussed how everything went during surgery, what to expect after surgery, discussed my follow-up appointment, how long to leave my bandages on, all that kind of stuff. Then physical therapy came in and told me some exercises to be doing. I'll kind of briefly go over those with you real quick. The first one was head up in this position and just chin down as far as you could put it without being uncomfortable. Physical therapy don't want you going down so far that it hurts. They just want you to gradually do these movements until you get back into your normal range of motion. That was the first one, and then the second one was just from side to side. Do that about 10 times. And then the third one was from this to that, and that's definitely the hardest one. Very, very difficult on that movement. So sit there, walked around a good bit today at the hospital. They took my drain out from the surgical site about an hour before discharged. And you can see right there's my bandage. I have about a 1-inch incision right there. That's where they marked that little arrow right there, where to cut at. Don't want them cutting on the wrong spots. But like I said, they took my drain out about 11 o'clock. I was discharged at 12. They give me this little thing, which use that in the hospital and outside the hospital for the first several days, kind of just to keep the air moving around in your lungs. You don't get as good a deep breaths following surgery as you did before surgery, so that kind of helps prevent getting pneumonia and all that kind of good stuff. And they encourage walking around as much as you can tolerate, just not doing too much. But like I said, 34 hours post-op right now. Pain's still a little rough. more pain at the surgery site today, like right there at the incision site, and swollen still a good bit. Tried to hold off on pain med as long as I could this afternoon, and probably tomorrow I won't hold off as long. Seems like if you maybe take it more so what it's scheduled every 8 hours or something like that, then probably be better off, because I went quite a while without taking any after I got home, and then I got to hurting pretty bad tonight, and then took some, and it's relieved a good bit of it. But anyways, this is day 2, 34 hours post-op, and to have had a major neck surgery, I feel like it's pretty good. Don't think I could ask for a whole lot more. But anyways, YouTube, I'll be continuing these videos. I'll try to do one a day for the first week, and then after that I'll probably go to one every 3 or 4 days and just go through my recovery like that.